MSc for Health, Mama Nomakosana. Mama, can you just maybe briefly explain to us what does it mean when you say you are commemorating Africa traditional medicine here in the Eastern Cape?
Good morning to you and your viewers. And the reason why you are here today is because on the 31st of August, it's a day that has been set aside to celebrate and commemorate the global traditional medicine. Therefore, as Africans, we are celebrating and commemorating Africa Traditional Medicine Days. You are saying we are doing this because the World Health Organization has researched and reported that more than 80% in Africa, of the people in Africa, still use traditional medicine. So we as a Department of Health in the province, we are integrating because there can be no Western medicine without the traditional medicine. So we are appreciating and also acknowledging the fact that our traditional health practitioners who have a calling, who are doing this not as a practice only, they've been there even before the Western medicine was introduced to our continent and the country.
But are there any concrete programs that really incorporate them so that they feel part and parcel of the modernized medicines here in South Africa?
I think it's a milestone to even recognize them. As we speak now, there's a legislation that recognizes the traditional medicine. And as the Department of Health, we are compelled to integrate, to work together with our traditional health practitioners. Even in situations where they've got patients that go to them, we've got a system of referral. We understand when they can't deal with a particular disease or sickness, they refer to us. Even our practitioners, as the Western medical practitioners, where they see that this thing needs a traditional health practitioner, we have a way of referring to and fro. And also we are integrating, working with them in even identifying things like malnutrition, where we are giving them those measuring tapes to look at the child if the child is malnourished so that they can refer the child to the hospital. So we are trying by all means to recognize one another and to work together, as we are compelled to do that by our legislation in South Africa.
Thank you very much. That was SABC Nomakosana from the Eastern Cape Department of Health, just emphasizing the coexistence between Western and modern medicine. But now I'm joined by a man who's representing traditional medicines, if I'm correct. Can you just introduce yourself, sir?
Tulani Templeton Mcimeli Umasoka.
Mr. Masoka, how do you feel about this? Do you see a change when it comes to recognition of traditional medicines?
Yes, because we have a voice. We are born and bred through this traditional medicine thing from our young age. And despite whatever interventions were made by other people who are against it, we are living it. We are what it is. We are a traditional medicine practitioner, the practice and the product.
But I'm sure there are issues that you want to raise maybe with the government. What are those issues that you think maybe need to be addressed before you fully recognized as a traditional practitioners?
As we need to understand that we have melancholies, cholerics, phlegmatic, and other people who have a different way of seeing things. Then we talk about integration, understanding between ourselves, acceptance, and working together, because we are here to stay. So there might be things, but we are addressing them because we represent the people who talk about these things, and we take them forth to the forums and associations, and there is working together in such, because somebody who's away from what we're doing, associations cannot understand what we're trying to do, and we can see there's a light at the end of the tunnel.
Of course, there is a light at the end of the tunnel. They are trying to coexist because at the end of the day, they have got maybe similar clients, if I may put it that way. Let me go back to you at studio.